Hey y'all, Kayla Mowdy, Doctor of Physical Therapy with another Monday educational moment. Today's topic is pelvic organ prolapse, sometimes abbreviated POP, particularly applying to female organs with this illustration here. So, bladder, uterus, rectum, the exits for those, and then the muscular and connective tissue that kind of hold everything in. Through the years, babies are not. Things sometimes stretch out and lose their elasticity. That's why we get wrinkles on our face. So kind of the same thing. If you think about that happening down here, everything kind of just drops a little bit. If you've had a hysterectomy, you're a lot more likely to end up with some sort of rectal or bladder prolapse because this space is kind of missing there, that space holder. So things tend to kind of fall. Bladder would fall into the front of the vagina, and then the rectum kind of loops over into the back. So this picture has numbers on it. 0 is normal, and then 1 is just a small amount. 2 is to the point where you would probably be symptomatic. You would feel like you're sitting on a ball. It would just be uncomfortable. I particularly see this more often in the evenings after long walks. Things might be okay when you first wake up in the morning because everything's been no gravity effect on it. And then you get up and you are doing chores, and as the day goes on, it just feels weird down there, uncomfortable. You can feel something if you, kind of feel around the vagina. It's just kind of a bubble or a bulge or sitting on something is what my patients tell me. Sometimes with rectal prolapse, patients feel like they have to kind of support the area to have a good bowel movement to clear stool. That's because it kind of gets stuck in this little loop here. So when you get to 3 and 4 out of the body, those are usually surgical fixes, but pelvic floor physical therapy, these 1s and 2s, are actually a great option to get everything working again as far as the pelvic floor muscles contracting and holding everything in place. Another great conservative option that I've had patients who were against surgical fix or just couldn't do the surgical fix at the time because they can't be 6 weeks down of not being able to lift and whatever. So this is a Pessary. It is a device that is inserted vaginally. The doctor or your practitioner must fit you for this to see which one you need to best hold what in place where. So there's quite a few different ones, and most of them they're covered by insurance once the doctor declares that it's medically necessary. But it's just something that's inserted. You must be comfortable pulling it in and out to do the cleaning and stuff like that. But it can be a very good non-surgical option if you just need to delay surgery or are just not up for surgery at the time. Pessaries are a great conservative option along with pelvic floor physical therapy for those 1-2s and early grade 3s that only happen kind of in the evenings. I hope this helps you understand maybe some things you've been feeling, hopefully not, but if you just feel uncomfortable down there towards the evenings, gravity, you've been up doing a lot, those that could be prolapse and you need to be examined by your doctor to see what's going on there, and they may want to do surgery, but just know that there may be conservative options if you're not actually fully prolapsed. Y'all have a wonderful day.